Hello, and welcome to today's webinar, Tackling Poverty in Rural Communities. My name is Ali Havrilla, and I'm a community coach with County Health Rankings and Roadmaps. I'm joined today by my colleague, Kate Conkle, who is one of our Action Center team directors. Welcome, Kate.
Thanks, Ali, and thanks everyone for being here today.
And our guest today, Melissa Freegang, who is the Vice President of Social Innovation and Workforce Initiatives for Logistics Specialties, Inc., and is working on Weber County's Intergenerational Poverty Initiative. Welcome, Melissa.
Thank you, and thank you for the invitation to join me today.
Yeah, so hi, Kate and Melissa. And just as we get started today, we wanted to let everybody know that Weber County is participating in the Rural Impact County Challenge. And as part of their participation in that initiative, I've had the opportunity to serve as their coach in support of their goals to address intergenerational poverty. I'm so glad that Melissa is able to join us to share more about the work that's ongoing in Weber County. So we wanted to take a second and acknowledge that County Health Rankings and Roadmaps is a program based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. We'd also like to acknowledge that the program is the result of the collaborations of many colleagues and partners in Wisconsin and across the nation. Thanks to their support, we're able to bring you this webinar today. And now I'm going to ask Kate to introduce the GoToWebinar interface.
Sure. So we want to take just a moment to get you oriented to the technology we're using today, especially for those joining us for the first time. I do want to let you know quickly before I talk about GoToMeeting that the September webinars will be our last webinars on GoToWebinar. In October, we will be transitioning to Zoom. So we'll have a new attendee interface to learn, and we'll work with you on that moving forward. But for today, the GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window. And this is where you'll see our screen throughout the presentation. And on the right, you can see the control panel. So a couple of things to point out here. First, you'll find handouts for today's session. You'll see the PDF of the slides. I know a lot of you ask for those, so those are there in the handouts. You can download them. You'll see a list of the related links that we'll be sharing during the presentation. So I'm going to be chatting out links throughout the presentation. If you want to ignore those so you can really focus on Ali and Melissa today, feel free to do so. We'll share the links with you. If you want to take a look at some things that catch your interest, go ahead and do that. And then Melissa's full bio is also available to view. And then finally, you can interact with us through the control panel using the question section. So I'm going to be kind of hanging out in the background during the webinar. I will be monitoring the questions that you're sending in, answering them as we go, and also looking for ones that we'll be answering at the end of the webinar during the Q&A section. So feel free to get those coming in as you have them, as you think of them throughout the webinar. And we'll be sure to leave time for your questions at the end. And again, look for those chats in the chat box.
Great, thanks, Kate. And before I introduce the roadmap for today's webinar, just wanted to highlight that I saw a question come in, and that Weber County is in Utah. And so we'll start today with a brief program overview to ground our discussion in County Health Rankings and Roadmaps, and this is going to take about 5 minutes. If you're newer to us, this will give you a high-level overview of our program, and to learn more, we encourage you to check out one of our Rankings and Roadmaps 101 webinars, and Kate's going to chat out a link to our most recent recording. Then we'll take a look at some tools and resources from our website that can help you address poverty in your community. After that, we'll turn it over to Melissa to share about Weber County, Utah's approach to working on intergenerational poverty. After we hear from Melissa, we'll be sure to leave plenty of time for questions, so please don't be shy. Send in those questions throughout the webinar, whether they're for us or our guests. Finally, I'm going to share a couple of exciting upcoming opportunities to further engage with one another. So let's start today by getting grounded in what it means to build a culture of health. Our partner, the Robert Wood Johnson Foundation, has laid out a powerful vision for building a culture of health in every community in the country. That vision includes the belief that all individuals and families should have the means and the opportunity to make choices that lead to healthy lifestyles regardless of where they live. In other words, building a culture of health requires everyone in a community especially those most affected by poor health outcomes, to have equal opportunity to enjoy good health. And this is at the heart of our work. One of the ways that county health rankings and roadmaps supports communities as they build a culture of health is by providing tools and resources grounded in data and evidence. The image on the right shows our approach to health and is at the foundation of county health rankings and roadmaps. This model of health shows that health is the sum of many parts. And so many of you may have seen this image before, and for others it may be new, so we're just going to take a minute and walk through the model. So starting from the bottom, in the orange box it says policies and programs. Effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of the communities. So moving up the model to health factors, this is the blue boxes. This shapes our community's health outcomes. And we specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. And we measure two types of health outcomes, and those are the green boxes at the top of the model to show how healthy each county is. This looks at length of life and quality of life. And so for each county, or for most counties, we provide county level data in the form of a county snapshot for each of the 35 measures that we use to produce the county rank. The measures are distributed across health outcomes and the 4 buckets of health factors. In your snapshot, you can also find additional measures which provide some additional data that may be helpful to you but is not used to calculate the rankings. So moving from the rankings and that model, this image is equally important, and this is an image of our Take Action cycle. It shows that in order to address health effectively, multiple stakeholders have to be included in the conversation. You will also you'll notice action steps around the cycle that start at the top right with assessing needs and resources and continue around the circle to evaluation. You'll notice that work together and communicate encompass the entire cycle because those action steps occur concurrently as you are completing the others. When on our website, you will notice that these action steps are hyperlinked. So this is where you can access the hundreds of practical tools and resources that will support you in moving forward in your work. So now we're going to take a second and focus on the data side of our work. And as I just did a brief introduction to, we rank the health of nearly every county in the nation annually, and it illustrates what we know when it comes to what is making people sick or healthy. And so your snapshot provides data to help understand what is influencing the current and future health of your residents. And on the slide, you're seeing measures related to children in poverty, which can assist you to build your case for action as you work with your partnership. This will help you think about what opportunities and gaps exist within your community. You may also want to look for additional local data that aligns with these measures. Today, we specifically wanted to highlight that you can explore the Children in Poverty measure in a couple of different ways from your county snapshot. When you look at the data table for children in poverty for your county, you are able to see data broken down by race. You can also explore the Small Area Income and Poverty website and the Community Commons Health Equity Assessment Report, which contains information on poverty by race, ethnicity, age, and gender. And right now, Kate is chatting out a link to learn more about the Children in Poverty measure that's included in your snapshot. On the solution and evidence side of our work, you'll find What Works for Health, which is our resource that provides evidence-informed strategies that can improve health. It serves as a starting point to help communities identify policies, programs, and systems changes to address their local priorities. And to date, it includes about 380 strategies. For each strategy, you'll find an evidence rating, which conveys the likelihood strategies will work based on available evidence, a short literature summary that highlights who a strategy can benefit, what it can do, and as we have it, information about cost, a disparity rating to help communities use an equity lens as they explore strategies, and implementation resources to move from idea to action. So before we look at some specific strategies, I wanted to highlight one of our resources, What Works? Strategies to Improve Rural Health. This report shares some strategies from the Rankings and Roadmaps What Works for Health database that can make sense in a rural community or low density areas. And right now, Kate is chatting out a link to this report. And so when you explore the report, it's a great starting point to help you tackle questions like what's working to prepare and strengthen our local workforce to reduce injuries, and what's working to improve access to high-quality healthcare and to improve diet and increase exercise. It also includes strategies that can help to address many other questions facing rural communities. Now, let's take a look at a couple of strategies you can find in What Works for Health while searching for family and social support. And as you'll hear from Melissa when she shares about her work in Weber County, adopting and implementing policies and programs that support relationships between individuals and across entire communities can benefit health. We are highlighting these 3 strategies today to spark thinking around what systems, policies, and programs might create stronger supports as you work on tackling poverty in your community, especially in disadvantaged families and neighborhoods where small improvements can have the greatest impact. So the first strategy that we wanted to share today was extracurricular activities for social engagement. And this includes any organized social, art, or physical activities for school-aged youth that occur during out-of-school time, usually before or after school or during the summer. Extracurricular activities can be offered through school, community, or religious organizations. And this strategy is scientifically supported to increase self-esteem and improve youth behavior. The next 2 strategies that we are highlighting today have an evidence rating of expert opinion, which means that they are recommended by credible, impartial experts, but have limited research documenting effects, and further research, often with stronger design, is needed to confirm the effects. So the first is social service integration, and efforts to coordinate access to services across multiple delivery systems and disciplinary boundaries, such as housing, disability, physical health, mental health, child welfare, and workforce services. Approaches to integrating and coordinating social services vary depending on community needs and service availability, and can be system or sector-based, agency-based, or client and family-based. The expected beneficial outcome for this strategy is to improve access to social services. And the third strategy we wanted to share with you today is trauma-informed approaches to community building. And this uses a comprehensive multi-stakeholder approach to support and strengthen traumatized and distressed residents and communities and address the effects of unresolved trauma such as violence, poverty, homelessness, social isolation, and racism. Efforts often include community building activities, along with housing development, leadership training, and supports for low-income and public housing residents. The expected beneficial outcomes for this strategy are to improve health outcomes and increase social connectedness. And I'd encourage, if you're interested in learning more about these strategies, to go into What Works for Health and check out the full description. And so with that, that was a very brief introduction to county health rankings and roadmaps. And I'd like to take a minute and introduce today's guest. Melissa Freegang is Vice President for Social Innovation and Workforce Initiatives for Logistics Specialty, Inc., where she leads specialized economic and workforce development programs aligning industry, education, social sector organizations, and governmental and public sector bodies. Using innovative and evidence-based business development, training, and job creation methodologies, Melissa's team helps key stakeholders integrate and navigate complex economic development, social and workforce systems, and delivering improved outcomes. She currently directs the Human-Centered Designed Job Training and Placement Program, Education to Employment for Youth with Disabilities, Financial Capabilities and Asset Building in partnership with Utah Community Action, and leads economic empowerment teams tackling intergenerational poverty, women in the economy, rural demographics, and job growth initiatives. Melissa is here today to talk about her success in bridging the gap between policy and practice through her work with Weber County's Intergenerational Poverty Strategy. Welcome, Melissa.
Thank you.
So to start us off, tell us a little bit about your work in Weber County and how long you've been working on this.
Happy to, Allie. So Weber County is considered a rural county from a national perspective, and the majority of our county is rural. However, we also have suburban and urban areas that makes our poverty and generational poverty issue quite unique. We've been very focused on poverty over the past several years, and our state has been keenly focusing on the issue of intergenerational poverty for the past 6. As they've honed in on key issues, indicators, and data sets toward that end, we also started to specifically address the issues of intergenerational poverty in our community about 18 months ago. We are very, very lucky to have our county commissioners invested in a solutions-based approach, and Commissioner James Ebert specifically is leading the charge to address the issue of intergenerational poverty. Having leadership invested in the human-centered design strategy and tying it to local community health, prosperity, and economic development initiatives is the key to sustaining this effort over the time it will take to break the cycle of intergenerational poverty. So as we began discussions of where our community wanted to go, we started with our county's health rankings and roadmap data on what poverty looks like in Weber County. And through the leadership of Lieutenant Governor Cox and Utah's Department of Workforce Services, we started looking specifically at the data the state is providing to us around families experiencing intergenerational poverty, also specific to our county.
Great, thanks for that overview. I'm wondering, for those who might be new to working on poverty or really thinking about how they can narrow their focus as they think about poverty in their community, can you tell us a little bit more about intergenerational poverty and why Weber County chose that approach as a starting point instead of, say, maybe a 2-gen approach or tackling all poverty in the community?
The state has defined intergenerational poverty as those children whose parents are currently on state assistance and were also on state assistance as a child. When we looked at how to approach the issue of intergenerational poverty, or IGP, we decided to create a structure around the 4 indicators of child well-being that the state has defined as their focuses for intergenerational poverty. Our IGP work is child-centric, while the state has recently moved to a 2-generational approach. Prior to this shift, they looked at the adult generation primarily through the Family Economic Stability Indicator, one of the 4 areas they've defined for child well-being. The other 3 indicators are early childhood development, education, and health.
So let's dig a little bit deeper into the data around intergenerational poverty in Weber County.
Yes, well, as we look at the data from the county health rankings and roadmaps, it gives us a good perspective on what poverty overall looks like in our county. Since we are fortunate enough to be provided county-level data specific to families experiencing intergenerational poverty by Utah's Department of Workforce Services, it gives us a deeper understanding of not only poverty, but intergenerational poverty as well. Currently, 10% of Weber County's children are experiencing intergenerational poverty, with another 28% of our children at risk of remaining in poverty as adults. That 28% in addition to the 7,000 children already experiencing intergenerational poverty. And for those 16 to 21-year-olds experiencing intergenerational poverty, 1,800 have children themselves. These statistics are staggering, but we are very fortunate the state is focused on this issue and providing us critical county-level data on an annual basis. It really provides us a starting point to tackle poverty in a meaningful way and to address the root causes of poverty while creating buy-in and from stakeholders around the shared mission. Being able to see the numbers broken out into the issues we know are relevant to age cohorts, like reading books and exposing young children to a larger vocabulary during their early childhood development stages, or literacy levels at 3rd grade, or teen pregnancy rates, all gives us the depth and metrics needed to get buy-in from the stakeholders around the collective mission, as well as assess the interventions and efforts being implemented. All of these aspects are so important to sustaining the efforts over time.
Yeah, so that's a great overview of sort of how the issue has been framed and the data related to the specific focus on intergenerational poverty. Tell us how Weber County began to move with data to action. Where did you start?
Well, the Weber County Welfare Commission was created first to address change at the local level systems and intended to operate as a long-term commission to provide consistency and sustainability to this project. Poverty in the broader context and community prosperity overall is really their mission. For this reason, it includes those who have the authority to make policy and legislative decisions and is led by Commissioner Ebert. The Intergenerational Advisory Committee includes other key stakeholders and members of the ecosystem, as well as representatives from the Welfare Commission. This includes those who have experienced or currently experiencing intergenerational poverty, spiritual leaders, legislators, nonprofit service providers, for-profit and industry members, and boots-on-the-ground practitioners. The chairman of the advisory committee sits on the Welfare Commission as well to create another connection point between the two groups. We have identified two critical factors in making sure these groups are effective. First, individuals experiencing intergenerational poverty have a seat at the table. This provides a critical perspective and voice so everyone can truly understand the nuances of intergenerational poverty. And second, we continue asking ourselves the question, is everyone around the table that we need here in order for us to move the needle?
Yeah, and I'm just going to pause here because I think that you're sharing some great little nuggets about the process that has unfolded in Weber County. And I think, the first thing you shared this when we were planning for today's webinar is that at each meeting, you really take the time to sit down and review membership and make sure that everyone's voices are heard and that all the right people are around the table, and really focus on making sure that especially those experiencing intergenerational poverty have a seat and have a voice. And then I think, a lot of this is speaking to, and I appreciate that you have the take action cycle on this slide, but the need to really spend time in that work together step, engaging everyone and really solidifying focus around the mission and purpose.
Absolutely.
So I'm wondering now, can you tell us a little bit more about how the collaboration of the advisory group translates into action in community that is focused on intergenerational poverty?
Sure. So as we've been tackling this issue, we knew we needed to get our arms around all of the initiatives and efforts already being done. So we decided to baseline where we were and started to build an asset and resource map for all of the services being delivered to children. We wanted to know what services were being offered, who the services were being delivered to, and the points of contact at each agency. As we started down that path, we quickly realized that the task was just too big and overwhelming. Not only were there so many great services that were being delivered, the sheer volume and size of the task became overwhelming, as I said, and we struggled to categorize them, organize them, and figure it out, and to figure out who even wanted to be a part of the IDP initiative. So we regrouped and reframed our approach through subcommittees organized around each of the 4 areas of child well-being. We thought if we could break down the task into smaller parts and organize it around the indicators, then we'd have an asset map aligned to the state's initiative and the data set, and could assess what is working and where the gaps are. That too, however, was daunting because of the size, the number of indicators, and how we would collect the data or identify the IDP child. So even though we decided to stop and needed to regroup again, before we decided to move forward, we learned a great deal about programming and resources. We also identified more barriers beyond just the vast number of great services being delivered. We identified barriers around data sharing, maintaining a shared data platform, the identification of the IDP child, and the differences in reporting requirements for each of the agencies delivering these services. So the exercise did yield some great information for us to use as we continue to move forward. Where we've landed is an approach to asset and resource mapping around specific targeted populations of children experiencing the negative effects of intergenerational poverty. For example, we know that 72% of 11 to 17-year-olds experiencing intergenerational poverty are involved in the juvenile justice system. As we think about these children, who are the agencies providing services to these children, and who else would we need to have around the table? We know juvenile justice, the courts, the schools, who are already trying to address chronic absenteeism to solve for graduation rates. But do we typically include spiritual leaders, coaches, or role models? And further, we want to determine not only who is the lead at each agency, but who is the person, the human being, delivering the services to the child and developing a relationship with them, as well as how broad is their scope with that child, or how specific is their scope with that child? So we've moved our thinking around a human-centered design methodology, and we are asking ourselves the question, how do we best wrap around services with known best practices to meet the specific needs of the child while aligning with existing resources, services, and provider coalitions?
Yeah, thanks, Melissa. I think there's so much rich material on the last slide and this current slide, and I think thinking back to the last slide and the process that you showed, it really demonstrated that when you got stuck, you were willing to stop and say, this isn't a good use of our resources, and we need to go back and really think about the voice of those experiencing IGP. And along the way, it also helped you continue to refine your focus. And it really speaks to the importance of staying in the now and honing in and staying true to the mission. And I mean, I know this is simple to say here on our webinar today, but in practice and community, it can be hard, and it can often feel challenging. And it, again, just highlights why it's so important to have the voice of those most affected by the issue you're addressing around the table.
Right. So we're really using a design thinking approach, the fail fast, iterate, start again, to make sure that we're continuing to align with our partners. It is how we've operationalized the action cycle into our Weber County Welfare Commission and Intergenerational Poverty Advisory Committee work, and continue to move toward our goal.
Yeah, and again, you know, it all sounds simple, but as I've been your coach working with you all for the past year, I've witnessed how you've iterated and how that process has played out. Why don't you tell our audience where you are now and as you continue to operationalize the system and move into action?
Sure. So we've become more innovative in our exploration for solutions and started developing new tools to create a holistic approach and method of service delivery to provide wraparound services for each child through a navigator. These navigators will provide trauma-informed approaches to service delivery that are grounded in an understanding of and responsiveness to the impact of trauma. Although not all children may have been exposed to trauma, the key principles can be empowering for any child. This navigator will be responsible for helping the child and family access resources and services customized to fit their specific needs. So the advisory committee has taken on the task of asset mapping around specific populations experiencing the negative effects of intergenerational poverty. And the Welfare Commission is looking at systems change, talking through the issues of identifying the IGP child, data sharing, and data platforms so that we can continue moving our work forward.
Great, thanks for sharing a summary of your current action and activities. Tell us about where the intergenerational poverty strategy is headed next.
Sure, so where we are headed next is to continue our work on the 4 indicators of health and well-being of the child identified through the state. Next, we will tackle equity and access for children and families of Weber County, as you can see in the second quadrant of the diagram. The bottom 2 quadrants are focused on the IGP child specifically. We know building resiliency skills in children can have a positive impact. The dignity component is really looking through the lens of the child and creating opportunities for role models, teachers, coaches, parents, and the child to interact in meaningful ways. When you hear people who achieve their goals, they will often say, my teacher, my grandmother, my mother, my coach, they believed in me, pushed me, and cared about me. We believe that by addressing these 4 critical areas, children in Weber County will grow up to be self-determined, which is the goal of Commissioner Ebert, the Welfare Commission, and Intergenerational Poverty Advisory Committee members, and how we believe we can interrupt the cycle of intergenerational poverty.
Yeah, thank you. I'm just going to cue our audience up to let them know that on the next slide, we're going to move into question and answers. So if you've got any questions, make sure you're sending them in. But before we go there, I wanted to step back and share some observations that I've had by having what I think is a wonderful opportunity to work with Weber County as a coach. And really it's that all along, there's been such intentionality to work at the individual, family, and community level to really make sure that there's strong directional alignment and commitment among every sort of policy, every policy system or program change that you're looking to either tweak or implement, and it really speaks to the strong value of collaboration as you're thinking about a complex issue like poverty.
Yeah, this is our human-centered design roadmap that we've laid out, and it positions the Welfare Commission to not only address the issue of intergenerational poverty in the longer term, but to also take on other critical community issues like immigration, community development, refugees, affordable housing, and workforce shortages. So we really have laid out the roadmap that we're testing now through this initiative to have a long-term mission for the commission itself.
Great, thanks. And so I think with that, we're gonna take a second and I'll turn it over to Kate and let's see if we can answer some questions.
All right, thanks, Allie. Sorry, they were trickling in and then all of a sudden the question box exploded. So we've got some great questions coming in. Melissa, I'm gonna start with what is hopefully an easy question that just do a little more foundation setting for people. We've got a question about what's the population makeup in Weber County? I know you kind of gave us a little bit about its rural, suburban, and urban, but if you can tell us a little bit more about the demographics, that would be great.
Yeah, so it's very interesting. I'm not going to tell you the county-wide as a whole because the uniqueness of our demographics is that we really have a pretty heavily populated white demographic that is very, very rural, farms and and very rural experiences. And then our inner cities have a lot more ethnicity, a lot more Hispanic and Black Asian populations. We're not as diverse as a Chicago or another urban center, but because of the makeup of the way we are geographically located and our urban, suburban and rural populations exist because we're set up right against the mountains. And so it's a very interesting geography with the way our demographics roll out in our region and in our county.
All right, thanks. So with that additional information, you talked a little bit about one of your next steps is addressing equity, and we've got a question sort of related to that, which is how do we make sure that rural programs don't worsen health disparities by serving the easy to access populations? So have you guys thought about that? What is your thinking around that?
Yeah, I think I would start with, we don't consider our IDP families to be easy access. So when we're thinking about delivering services, we want to think through first what some of the barriers are, and rather than provide services in maybe some ways that might increase barriers, we want to take the services to them and remove the barriers. So, for example, take the services and take the coalitions and the navigators and the teams into the schools where the children are, or not provide family economic stability during work hours when people have to make a choice. So it's really trying to take services to them and access everyone. And by targeting the specific populations of individuals, it's really an intentional approach to try to make sure that we access everybody.
Great, thanks. I think that's such an important point of thinking about how you go to where people are instead of always expecting that they come to you. And we've got a question somewhat related to that maybe, which is, what did you do specifically to get people experiencing intergenerational poverty to the table? This is a huge question for a lot of communities we work with, that whole community engagement piece. How exactly do they participate? Do you provide compensation? So what was your process to really create that space for folks to come and join?
Yeah, so really it was through our membership of the commission and the committee. So we have one of our religious leaders bringing an individual to talk about their experiences and really give us a great sense of what they're experiencing. We have another individual who has grown up locally in Ogden, who comes from intergenerational poverty and actually has created a nonprofit and is a poet, and talks about some of the experiences that he has been through, and he provides a very nice, rich perspective as well, having being relatively young in terms of his age, and also in terms of his diversity, and then what he did and the experiences he had to break through and out of the intergenerational poverty cycle. So it was really just reaching out, asking, and leveraging the work of our great community leaders as well.
Great, thanks. So switching gears a little bit to indicators, do the child well-being indicators include anything related to social support and cohesion or social connections? And if so, what are those? If you're able.
Yeah, that's a really great question. Yeah, and that's a really great question, and I'm not the expert on the Department of Workforce Services indicators. I guess I would ask, are you talking about the 4 indicators of child well-being, or where we're moving forward with self-determination? Sorry to ask the question back. Maybe I'll speak to both.
It sounds like yes or either was the response.
Great, sorry about that. So the indicators of child well-being, you can look up, I think, Kate, you sent out a link during my presentation, and so I can't think of a specific social, emotional indicator or connection piece there. However, our work with the self-determination is certainly something that we consider the social pieces of it. So when we're talking about dignity, that's really the quadrant that we're talking about. We believe that really having that social interaction, having role models, having children experiencing, and hopefully they're experiencing them from their parents, but if they're not, we want to make sure that we have multiple opportunities for young people to experience being treated with dignity and loved and believed in. And so what we're doing through this bucket is really talking about how can we in the future create these relationships, not only with the navigator, which would be a primary relationship, but also connecting to coaches and community members. And this was I had the opportunity to do TEDx Ogden and really did a call to action to our community members to continue to volunteer and to coach. And so that component is absolutely critical, we believe, to really the self-determination is that social framework. And then the resiliency piece is more formal and structured, but you would get some of that relationship based through teachers and people helping to build those resiliency skills.
All right, great, thank you. So we're going to go back to some of the partnership pieces again. And, schools have a lot going on. They have a lot on their shoulders and a lot of competing priorities. So someone's asking, are the schools really receptive to having a bunch of services coming in? It sounds like you were taking some of the services into the school setting. How has that relationship worked, or how have you kind of brokered that or negotiated that relationship to have that happen?
Absolutely. So on the Welfare Commission, we have both superintendents who serve on that commission. And then our schools have been really focused on, of course, efforts around absenteeism and those sorts of efforts. And then they have recently really started to look at poverty and intergenerational poverty. So what we did is actually just ask them what they needed. So what are their current programming? How can we help them, and how can we help them grow their best practices? And so rather than tell them what they need to have or what we are going to do for them, they have a seat at the table, and we want to help leverage what they're already doing so that we can build that out rather than implement something new. Really what we're doing is acting as an integrator and leveraging the great work that's already being done and then helping to grow that. So the schools have been extremely receptive, and it's a big issue in our schools. And so they have really been gracious and open-armed about that. So, but I think the approach was really just to say, what is it that you're already doing, and where do you need the help? And how can we serve our children collectively?
All right. Thanks, Melissa. And we still have lots of questions coming in. So we'll stick on the path of partnerships and buy-in, and just more broadly, how are you able to get buy-in from all of the community leaders, the nonprofit leaders involved in the initiative? Especially, it sounds like you've done some stops and starts and have really taken the time to build the relationships in the process. But how have you been able to get the buy-in from all of these different partners?
Yeah, I think a couple of different approaches. First, we are very child-centric. So it really is about addressing root causes rather than band-aiding symptoms. And so it's not to say that, people are in crisis, and so those services are absolutely critical. But along with those services being provided, we're also talking about how can we really move the needle. And like I shared in one of my slides, really connecting to the local economic initiatives is pretty critical because our intergenerational poverty youth and our poverty youth are really critical to the pipeline to meet workforce demand. And if we have a knowledge economy, which we do, and we're growing in technology and information technology and advanced manufacturing is very large here in our state and in Weber County, specifically aerospace, we need to make sure that we're providing lots of access points for you to say, I want to grow up to be X, Y, or Z. And so really it's making sure that we are aligned on not just the human services side, but we're really aligned to the economic development initiatives, because ultimately when we remove people from state assistance, it's a cost savings. And then when we help them align to employment later on in life, it's a revenue generation. And so it really is an economic boost to your community and community prosperity. I would say second, we align everything that we're doing. So I mentioned the TEDx Ogden. So we take lots of opportunities to connect the issue to a lot of things that are happening. We want to really often make sure that we are bringing it to the conversation, whether it's through specific conversations around intergenerational poverty in the commission and the committees, but we also want to align it when we're at the school foundation meetings or when we're at the legislature during session. And so it really is to try to find opportunities to keep it on the front and center so that people stay aligned and say, oh yes, this is what we're doing. And then third, I would say really making sure that we're action oriented so that people who do come to the meetings walk away knowing that the next meeting we're going to have made progress, and we're not going to come sit down at the table and continue to talk about the problem. We're defining the problem, and actually we're finding more and more problems as we go along, but we're also really working towards solutions as we move forward.
Great, thanks. And this is maybe a kind of related question. And this is, this person has said, some communities we work with have resistance to using data and then matching interventions with process and outcome measures. I would say that you are not alone in that. There's lots of communities with that challenge. Any advice on how you've really been able to get your community to dig into the data and really be thoughtful about how you're matching your interventions with what you've set as your focus, as your vision, mission, and goals?
Well, we are right in the middle of it. So what we have right now as we speak, we are deep diving the data and the intergenerational poverty data sharing. So our Lieutenant Governor Cox is the chair of our statewide Intergenerational Poverty Welfare Commission, and they are also addressing the issue. But with Weber County specifically, we have attorneys and experts and policy experts looking at it to see is it a legal issue? Is it a state issue? Is it a federal issue? We know they're all of those. But what are ways that we can put our heads together and get the best minds to talk about how we can either change policies, adapt them, do waivers, data sharing agreements, having participants fill out waivers. We're really looking at what are the types of reporting that people do anyway, so that we may not directly tie or align other reporting metrics specific to an intervention, but we use all of those data metrics and measures and outcomes to say we can't have a direct causation, but we definitely want to see some of these trends moving as we move forward from a longer term perspective. So we're right in the middle of the data sharing and the data platform, and we have a commitment by the end of October to either have a solution to data share, or we will have a workaround, and then we will move forward. And so I think hopefully that's helpful. But yes, we're right in the middle of that, and that's how we're tackling the issue is to make a determination, get the best minds around it, and then decide how to move forward and then go.
All right, thanks again for these comprehensive answers. So we've got a couple of people that are interested in diving into a little more specifics around kind of the programs and the work that you're doing. So one specifically asking, you mentioned the wraparound services that include multiple community partners. How are those operationalized? What would that look like in action?
Yeah, so really what that would look like in action is to, and this is why the asset mapping is so important, we need to understand what is being provided and where the current resources are in terms of program and services, so that what we want to do is to bring those partners to the table so that we're leveraging those partnerships. So for example, I'll be very specific with the Family Economic Stability Indicator, helping the adult generation find employment or become economically stable. The idea is to use a navigator to work with that adult, as an example, who's the parent of the child, obviously, and really do an employability barrier assessment, and then help them navigate the existing resources in our community so that they build an employability action plan. So they're actually active in removing the barriers to their employment. And sometimes the barrier can be substance abuse, as an example. So how do we utilize the services that exist in our community? And there are a lot of them. There's great government resources and programs, and there's also really great nonprofits providing these services and expertise. And so really the idea is that we would help the person understand what their barriers are, understand what the community resources are, and then help them navigate the systems so that we can integrate all of those great services around that particular person. So it really is customized. And then the second part of operationalizing that is to work with the employers so that they also can be a partner. So for example, a very specific example, if we have someone who completes their high school diploma and they want to become a composite technician, we help them fill out a FAFSA and understand how to get a Pell Grant. We have them fill out and see if they're eligible for the Department of Workforce Services training dollars. And then we work with the employer to communicate with them and do work-based learning experiences so that they can hire them for maybe an entry-level wage while they're getting their certification. And once they get their certification 6 months later, for example, then increase their wages and give them a promotion, or hire them on as an entry-level worker and then provide tuition assistance. So it's really being innovative and customizing around that. And then when the employer provides training to the person, not only perhaps they have tuition assistance, they can also access custom fit dollars as an example. So we help that employer also access our great educational institutions, our post-secondary institutions, and maybe some resources like OJT dollars through our workforce services. So really just looking at both halves of that and making sure that we're providing these integrative services to help them navigate what they need to move forward.
Wonderful, thanks. So I think we have time for probably one or two more questions before we move to our wrap up. So we're going to go back to a big picture, which is, are you seeing any measures, any indicators of what you're doing, that what you're doing is working? Any measures of success that you're starting to see that you're able to build on?
Yes,
or too
so
early?
Utah and Weber County have really done a lot of work in the early childhood. So we are seeing a lot of great work coming out of the efforts there. That's really been a 4 or 5 year genesis, really. So we've seen some really great efforts there. We are not deep diving quite yet. We're still doing the work, and so we haven't implemented anything per se in terms of the Welfare Commission or the Intergenerational Poverty Advisory Committee. So we don't have any specific examples. However, our schools and our district courts and our JJS have some really great practices that they have been implementing. And I can certainly either send those out later, or anyone who would like more information on what they're doing, I'm happy to share that via email, or at least a website where they can find more information.
All right, and maybe we'll wrap up with this last question, which is, you've started to talk about this. You know, poverty is a huge issue, and you've done a great job of starting to tackle it in small chunks and make some progress. What advice do you have for those communities that are maybe just starting to work in this area, really starting to think about how to begin to tackle kind of this big issue of poverty?
Yeah, I would say that, you know, find a way to break it down into chunks that you can address and move forward on, because success breeds success. And so I think that's a great question. You know, we've been fortunate enough to have data around intergenerational poverty and really leveraging the state's work. So that's been great for us. I would say identifying agency leads. A lot of times in communities, there are large nonprofits like the United Ways that have efforts going on. And I would really look at what you have in your community and find out what the big momentum piece is, and then leverage that to build more success. And so what I mean by leverage that is, you know, approach them and say, how can we help you? Because that's a momentum builder, and it really starts to break down the silos, which is so critical. So it brings everybody together. And if you can align with an existing agency that has a lot of momentum, then you'll also have momentum as well. I would look at industry trends. A lot of times that can be a momentum builder. So to have early employer engagement and industry engagement to get that other side of economic development is, I would say, is really critical. So you could identify, you know, an industry sector if you wanted. I would also say that what you may want to spend some time around is really tackling what the real problem is. So ask the question of what are we trying to address, and then ask the question of what, and then ask a deeper dive question after you've answered the what, ask the so what. And I think that a lot of times having a facilitator facilitate those conversations really starts to peel back the layers of the onion. And then the last sort of thing I'll sort of throw out there is really to potentially look at it in cohorts, or define if you want to do short-term strategies, long-term strategies. Do you want to be proactive? Do you want to take care of some of the reactive pieces, the crisis pieces? It's really just defining a course direction and then moving forward. And I will just say that what is so critical is really using the data to tell your story. And so whatever you decide to do in your communities, I think someone asked the question, how does this align, how do you align the implementation, the intervention with the data set? I would just be true to that. And a lot of times you can tackle a chunk based on what you know, what the data is, and who the people are attached to that data, which is really what we're trying to do.
All right, thanks so much, Melissa, and thanks everyone for your great questions. There were a handful that we weren't able to get to on the webinar today. We'll do our best to answer those via email offline. And I'm going to turn things back over to Allie now to wrap us up and share some upcoming opportunities with you all.
Great, thanks, Kate. And I would just echo, having the opportunity to just sit and listen to that back and forth conversation. Thanks to everybody for great questions, and Melissa for leaning in and really providing some rich responses. And so I'm going to kick us off this first opportunity we wanted to share with you, and there are three, so hang with me. The first one is an upcoming discussion group on Tuesday, September 19th at 3 p.m. Eastern Time, and this discussion group is a chance to dialogue with your colleagues across the nation about what you've heard today and learned today about tackling poverty in rural communities. We'd note that this conversation is different than our webinar because it will be facilitated interactive discussion in which you can share what you're doing locally as well as ask questions of other participants. So please plan to attend. Registration is limited. And video conference is highly recommended so you can meet others and talk face-to-face and build a strong network. And just a little bit more about that discussion group, some details. We would ask that you think about reflecting on these questions to prepare for the discussion. And we encourage you to submit questions or topics you'd like to discuss when you register for the discussion group. This will be a facilitated conversation with Joanne Lee from Active Living by Design, who's the lead facilitator. And if there's great interest in having even more post-webinar conversations on this topic, there will be an opportunity to continue with Active Living by Design support. And I believe right now Kate is chatting out the link to register for this opportunity next Tuesday. The second opportunity that we wanted to share with you is the Rural Impact County Challenge, and it's what we refer to as the RIC. And this is what Weber County has been participating in. They participated in the first round. It's sponsored by the National Association of Counties, and it's a national initiative to help counties advance efforts to reduce the number of rural children and families living in poverty. RIC recognizes and supports counties making a real difference in the lives of children in rural communities. One of the resources available to some RIC teams is community coaching. And so through County Health Rankings and Roadmaps, community coaches like myself work with county teams as they work to address childhood poverty. We'd encourage you to visit the link and consider applying to participate in the second round of the Rural Impact County Challenge. And I'd just note that applications are due Friday, November 3rd. And the third opportunity we wanted to share with you today is the Robert Wood Johnson Foundation Culture of Health Prize, which recognizes communities that have placed a priority on health and are creating powerful partnerships and deep commitments that will enable everyone, especially those facing the greatest barriers to good health, the opportunity to live well. The prize honors whole U.S. communities, and selection is based on 6 criteria: defining health in the broadest possible terms, committing to sustainable systems changes and policy-oriented long-term solutions, creating conditions that give everyone a fair and just opportunity to reach their best possible health, harnessing the collective power of leaders, partners, and community members, securing and making the most of available resources, and measuring and sharing progress and results. And so we encourage you to visit the link here on this slide to learn more about prize eligibility, criteria, selection process, and key dates. The first round of applications for the 2018 prize competition are also due Friday, November 3rd by 3 p.m. Eastern Time. And so as we close out, we'd encourage you to stay connected with us at County Health Rankings and Roadmaps. There's a couple of different ways to do that via social media, Twitter, Facebook, and our e-newsletter. And finally, we'd just like to extend a huge thank you for being with us today. You can see how to connect with us at County Health Rankings, myself, and Melissa. And so thank you.